Hello everyone. Welcome to Health Talks by Medicover Woman Child, Hyderabad. I'm Dr. Sangeeta. I'm pleased to introduce one of our senior consultant gynecologists, Dr. Anusha Reddy. Welcome to Talk Shows, ma'am.
Thank you.
Today she's here to talk about infertility. Ma'am, basically what is infertility? Does the age really affects the ability to conceive?
Okay. I'm Dr. Anusha Reddy, Obstetrician and Gynecologist and Laparoscopic Surgeon at Medicover Woman Child Hospital. I'm really pleased to talk about the infertility topic, and the nice question she has asked first. Everybody should know what is infertility. So infertility is nothing but a married couple, who is not able to conceive after a year, after having a regular unprotected intercourse. Then we call it as infertility. So she asked that any age related factor is there, definitely. So if as age grows, the ovarian reserve in her particular woman will decrease. So the conception rate as age increases, it will decrease. So whenever the married couple who is newly married, irrespective of age, they need to come to the hospital if they are not able to conceive within a year. And if they are elderly, and if they are having high risk factors like obesity, and if they are having PCOD and some other risk factors, then definitely they need to seek the doctor consultation within 6 months itself.
Ma'am, when does a couple needs to be evaluated for infertility? How do we counsel them?
So as I said, actually, if the married couple, if they are not able to conceive within a year after an unprotected irregular intercourse, then definitely the evaluation is required. So after having even unprotected sex also, they are not able to conceive, means definitely there is some problem is there. So they need to be evaluated, and even the elderly woman also has to be evaluated. The evaluations start from history taking. So when the couple both walk into a hospital, to the clinic, and so we take thorough history of them, and we ask how the age and how is their sexual practice, and whether they are using any contraception, and what is the age of the husband, and whether he is a smoker or alcoholic. All this we should know, and even we start evaluating the husband first, and we need to get his husband semen analysis. So if the semen analysis is good, and the count and the motility and the morphology is good, then we proceed investigating the woman.
Doctor, how do we evaluate a couple for infertility, and what are the available options?
Yes. So first I would like to explain about the causes of infertility. 40 to 45% is the male infertility is the cause, and the 40% is female infertility. So both has to be equally evaluated, and as I told you, the husband has semen analysis has to be done. If any problem with the semen analysis, then they might need to consult an andrologist or a urologist for the sperm count improvement. And coming to the female, there are many factors are there which causes infertility. First, we divide into 4 factors. That is ovarian factor, and any tubal factors are there, any uterine problems, and any cervical problems. So first major issues comes with the ovarian problems. So ovaries, whether they are regularly ovulating or not, the periods are regular or not, and if their periods are regular, whether the ovulation is happening or not. And definitely if it is irregular cycles, ovulation is, those are anovulatory cycles. So the ovulation doesn't happen in time. If it happens also, it doesn't happen in time, and even sometimes the ovulation is absent. And the ovarian factors, the most commonly these days what we are seeing is PCOD. So PCOD, polycystic ovarian disease, is nothing but it's a lifestyle disorder which causes cysts in the ovaries, which leads to infertility. The ovulation is compromised in that condition. So those conditions we have to ask the patient, we motivate the patient to lose the weight, and we try to regulate their cycles, and then we help them to conceive. And then next coming is the tubal factors. So tubal factors is that whether they have any block in the tubes. So in spite of ovulation happening, even then they are not able to conceive, means there is some block in the tubes. So we have to check. How do we know? By doing HSG, that is hysterosalpingogram. By doing that, we'll know the patency of the tubes. And even we can do the diagnostic lab, and we can see the any ovaries, how they are anatomically located, and how is the uterus, and the patency of the tubes we'll do by seeing the by doing the diagnostic histro lab. And next comes the uterine factors. So uterine factors commonly is we see inner lining of the uterus, and as well as is there any fibroids are there, and if the fibroid is there, whether it is located inside the endometrium or obliterating the endometrium, then the fertility is very difficult. And we see the cervical factors. Cervical factors means in the cervical mucus, is there any anti-sperm antibodies are there? So if there is any anti-sperm antibodies is there, whatever the semen is deposited, it will get lysed. The sperms will be killed, so they won't be able to conceive. So we evaluate in a methodological way. We first evaluate husband and then followed by the woman. So we find out the cause, and then we'll try to treat the root cause.
Doctor, do you really think that psychological health of a patient affects the physical ability to conceive?
Yes, definitely, Sangeeta. Usually, if you take so many of them I'm seeing these days, married couple, and they are more keen on financial settling, and they are more worried about their job, and they even they work late nights. And when they psychologically stressed out, it's very difficult for them to conceive. Especially you take men, and it might affect their sexual ability, as well as even for the woman. If you take they prone to get obesity, and they might chance of being PCOD is more common if they are very stressful. And if the sleepless nights and overworking, stress definitely leads to the inability for them to conceive. And there is some study says that if they're too much stressed, there is a cause of even tubal block also. So as much as the stress free, the ability to conception will be high.
So doctor, what is your take home message to a couple who are trying to conceive?
So the take home message is that if the couple if they are elderly, if they get married at the later age of the later part of their life, so once if you cross 35, please don't delay, and as early as possible please come to the hospital and seek the gynecologist opinion, because as the age increases, there is high chance of ovarian reserve will decrease. So then later stage, if you come too late to us, we might not able to help you also. So as early if you come, the treatment we start treatment, and then the results will be that good. And if a married couple, even in the younger age group also, if they are not able to conceive without using any contraception for 1 year of regular intercourse, and they are not able to conceive, definitely those couple also has to be evaluated. So and stress-free life is very important. Please do regular exercise, and your BMI should not be overweight, and always healthy diet, and taking lot of fruits and vegetables, antioxidants, and that will definitely help you to conceive. So never be in overweight, and regular exercise and stress-free life and adequate sleep definitely will increase your fertility rate. Thank you.
Thank you so much. Thank you, ma'am.